Welcome back. This is the fourth episode of The Light Within, and today I want to go into the topic of energy hygiene or etheric hygiene, which is how the healer keeps themselves from taking on the problems of their clients or from having compassion fatigue or burnout. This is something that happens no matter what kind of healthcare professional you are, so even if you are not a pranic healer, you can benefit from this. So energy hygiene is something very simple that we use. I can't exactly show you right now, but when we do pranic healing, you'll notice we do the sweeping motion and then we flick the hand, right? Because during one of the main techniques in pranic healing that you use all the time is cleansing, right? It's removing. In Chinese medicine, they will call it sedating, right? So they'll turn, when they put the needle in, the acupuncture doctor will turn the needle either clockwise or counterclockwise. And there's many different techniques. In Tui Na, which is the Chinese form of physical therapy, they will do certain movements with their hands to either sedate, meaning to remove the blockage, right? Or correct the blockage, or to tonify, to put chi or energy in, right? In pranic healing, we do like at least 60% cleansing compared to the energizing portion, right? So then when you see us like this, it's like we're bringing in or we're inhaling prana, right? And then we exhale prana out of the other hand, right? And yes, you can do it with breathing too. And it doesn't matter which hand in pranic healing, but we energize, right? So when you're doing the cleansing portion of pranic healing, you will notice that we'll have a bowl of water with salt in it, and we'll throw the energy that we cleaned into the salt water, right? And then you'll also see us with a spray bottle that we will spray our hands with. So you'll see the healers going like this. It looks funny sometimes, but once you learn a little bit about pranic healing, you'll understand what it is. So you clean, right? We might clean an organ, we might clean a chakra, right? We flick and spray. That's our mantra, is flick and spray. So it's a simple technique. I mean, how much does, in most countries, my understanding, at least in the United States, salt is very inexpensive. It doesn't cost very much to get a container of salt. So I buy bags of salt from like the bulk restaurant stores, and I put it in salt water and mix it, and then I use that as my disposal unit, right? So a lot of healers that don't use a disposal unit, and there are times when you can't, and in the pranic healing classes, you're taught all the different ways that you can adjust if you're not able to use a disposal unit. Like for instance, as a nursing assistant, I was in the hospitals often, and you can't bring a salt bucket into the hospital. They'll think you're crazy. But sometimes it's nice when you're at the ocean, because you can throw the energy into the ocean, because the salt content in the ocean is very high, maybe even more than in the salt bowls or buckets. So you'll see us doing the sweeping, spray, and then you'll see us scanning, right? So the purpose of telling you this is that it's so simple, it's so easy, right, to use in a spray, an astringent, which has lavender oil in it, and a bucket of salt water. Those are like your only two tools that you need for pranic healing. Again, if you don't have them, you can still do pranic healing, and the level 1 workshop will tell you all the different ways that you can do healing. But some healers have noticed that when they don't use a disposal unit, they will have a weakness in their legs. And that's because the energy, just kind of like dust, will settle on the surface, will settle on the floor, right? And then because you have energy centers and energy channels in your feet and legs, you will absorb that, whatever you want to call it, contamination. You'll absorb that, energy of disease or stress that came off of the client. Why would you want to do that if you could very easily just put a bowl of salt water, right? And there are some healers in different traditions that have taken my class, and they don't want to do this part. But then over time, when they do pranic healing, they start to notice that they have problems. And this is the purpose of the topic on etheric hygiene, is that very simple things like using the spray, when you're doing healing, and using the salt bucket can really help you maintain your energy level as well as prevent taking on problems of your clients. I've talked to massage therapists, so many massage therapists that will say, if I work this week on a lot of hips, I'll have hip pain. Even if they're not necessarily using their hips more for those massage sessions where someone has hip pain, but they end up with hip pain. Or if they're working more on shoulder pain, they'll have more shoulder pain, right? So, I mean, I've heard this routinely from massage therapists. And so I will teach them the spray. I'll give them a spray to use in between sessions, and I'll have them put a salt bowl in the room, somewhere that the client can't see it so that it doesn't look weird. But, just something, even though it's a little weird looking, it makes a big difference in your own health and in the health and the longevity of being a healer. How long can you be a healer? I remember being told once that at a massage school, there were tables being donated regularly. And they started to ask, why are you donating these perfectly good massage tables? And they would say, well, because, the massage therapist burnout rate was something like 3 years at that time. So massage therapists would start doing massage, and within about 3 years, they would end up either with an injury, or they would end up, just not being able to do massage anymore. And massage is something that you can age out of, right? But pranic healing, as long as you can move your hands, right, that you can do it for a long time. You can have longevity as a professional healer, which is what I do. But even if you just want to do healing for your family or friends or your pets, you can do it as much as you want without having any problems yourself, right? So what more could you want? Now, that's the topic of etheric hygiene, and it's a long topic. We can talk about it for 2.5 hours in the pranic healing workshops. In some of the workshops, we will actually clean, after doing healing, we will clean both, sides, the inside and the outside of our arms, right? With a color prana. That's in advanced pranic healing. And then you can compare your hands, and most of the time you'll notice that the hand that you did cleaning on is much cleaner, right? Or, much lighter. So all of these etheric hygiene tools, if you're interested in these, if anyone's even watching this, then I'm not just screaming into the void, then comment or send me a message, and we can talk more about, or do another video about, energetic hygiene, because it is so important. Now, one of the things that I wanted to talk about in the Light Within article is, like I was talking about the hospitals recently, integrating modern medicine or allopathic medicine with, things like Chinese medicine, Reiki, and pranic healing. So in San Diego, which is close to where I live, they have a healing modality that is in one of the most popular hospitals, right? So it is a touch form of healing, but they also work with the energy, right? We work with them once a year at least, and they have a great community of healers, and they teach at the hospital. It is taught to the nurses and to the medical professionals. Now, we show up to the conference once a year, and we do healing, pranic healing, alongside the Reiki and the healing touch practitioners, and we do healing for all the medical doctors. And it's an integrative medicine conference that is trying to bridge different types of healing into modern medicine, because many times I've heard this, doctors will say that there's a limit to what they can do. And, even though there's also a limit to what we can do in pranic healing and in Reiki and in all the different healing modalities, being able to have a tool belt that's full is super important. So integrating pranic healing into the medical community is something that's being done in other parts of the world. I guess we don't have as much of a focus on it here. We in Southern California, we do it as much as possible. In fact, the level 1 I took was with a licensed counselor, right? And the person who introduced me to pranic healing in the previous video was a clinical social worker, and she was a pranic healing instructor as well. So when I came into pranic healing, my first class was There were podiatrists, there were counselors, there were cardiologists, there were all kinds of medical doctors in my class. And I was the only one that I was just still a student. And so I thought pranic healing from the beginning was a part of medicine. But then as I went through, I learned a little bit more. It's not part of medicine. It can be, though. And that's the important thing. So I always like to tell this story. I was working as a nursing assistant with hospice, and I would be taking care of the client, and a lot of times the client would be close to death. And at first it was morbid to me, but at a certain point, seeing this happen multiple times, seeing people, pass multiple times, I realized it's actually a very beautiful process when there's not pain. And so hospice does a good job of, at least what I've seen of it, at helping to make these people comfortable. So I was taking care of a couple, and the gentleman was on, he was having his blood pressure and his blood oxygen monitored, and I was basically supposed to call the nurse if the blood oxygen went below a certain level. So in pranic healing, I thought, well, I have to stand here and watch him all night long because I was on a night shift. So it was from about 9 to 3 in the morning. I had to stand there or sit there in the room and read a book or whatever and just watch this guy. And he was a really wonderful person, and it was sad to see him go, and the family was wonderful as well. And I thought, let's just experiment, because he's hooked up to a blood pressure monitor and an O2 monitor. So let's just see if I can affect it with pranic healing. So we have a technique that we can do when somebody is passing to either produce a miraculous result or help them pass painlessly and without struggle. So part of this technique is in the level 1 class. I'm giving you lots of hints and lots of reasons to take level 1 if you haven't already. It's called general sweeping, where we split the body into 5 lines and we clean every line, right? So you clean the entire body, and then you go in and you work on individual areas, or wherever the pain is or wherever the problem is. There's certain areas that you work on. So I thought, I'm just going to stand here. I did have my spray bottle because the wife was asleep in the other room, and I didn't have a bucket, so I used a different method. But I started doing the general sweeping, right? And I would notice that his blood pressure would actually go up. It was very low, and it would go up to normal, and the blood oxygen would go up to like the high 90s, and it was in the 60s or something like that. It was really low. So I would do this general sweeping, and then I would see on the monitors that the numbers were going up. So it was exciting for me to see that. And I thought, oh my gosh, what if he wakes up, because he was not conscious, but he had been on morphine and other things, so he wasn't coming back. But I had hope, So I went and sat down, and I was reading a book, and I started seeing the numbers going back down. So I got back up and I started doing the same thing, and the numbers went back up again. The oxygen and the blood pressure went back up, and even his breathing seemed to be less difficult for him. So I went and sat back down, and it happened a 3rd time, and then a 4th time, and a 5th time. So every time I got up and I started doing this general sweeping on this gentleman, his oxygen and blood pressure was going to a normal number. So that was really exciting for me, and it got to a point where I did this for probably 2 hours because I was enjoying it, and it wasn't hurting him. He wasn't in any kind of pain. And I remember I finished one, and I said, this is the last time I'm gonna do it. So I finished doing what used to be called the send-off technique. It helps somebody that might be in the dying process, it helps them leave very comfortably. And if they don't, then they sometimes will have a miraculous result. I've seen both happen. So I finally said, I'm going to do this technique one more time, and then I'm not going to do it again. So I did it. It's 13 sets of these 5 lines, right? And I did the 13 sets, and as I finished the last set of 13, I was watching him the whole time. I'm monitoring him. His oxygen level went to the point that I needed to call the nurse, and I called the nurse. I woke up the wife. We came into the room. He inhaled and he exhaled, and then he just never inhaled again. And I thought, wow, that was so peaceful. How was that so peaceful? When you think of death, this is big buzzword on the internet. You're not supposed to say it anymore, but I don't care. It's the word for it, right? When somebody dies, we often associate it with trauma and pain and screaming and crying and all of this, upsetting stuff. But this was not upsetting at all. This was somebody who had lived, I think, well into their 90s, and was able to, with a combination of medical care and pranic healing, I hope, was able to transition very peacefully. And this was something for me that was very interesting. And now I've done this so many different times on people. I did it with somebody else who was in the hospital. Family member called me and said that he was just, their family member had a stroke, and he was just hanging on, but he was suffering and he wasn't going to make it. But he, for some reason, was hanging on. So I did this same technique, and she said, "What time did you do the technique?" And I said, "Well, I finished at about this time." And she said, "Look at this." And she sent me a text. She was a nurse. She said, "Look at this." And she sent me a text message. The time of death was 2 minutes after I had finished the technique. Right. So I thought, wow, what if we had more of this in the hospitals? What if nurses were trained to do this, or medical professionals were trained to do this? Now, if you look online, you will see an old CBS News video with Master Stephen Coe, who's my personal teacher, as well as Dr. Eric Robbins, who is a longtime student of Master Cho Koksui, the founder of Pranic Healing, and Master Coe. And he's a medical doctor, and he speaks in that CBS video. You can find it on YouTube or online, anywhere. He speaks about using pranic healing to stop bleeding. He's a surgeon, so he would use pranic healing to stop bleeding. He would use it for pain relief. He did it for so many different things in the hospital setting, to the point that his colleagues that were not having the health outcomes that they wanted with their patients started to send their patients to him, because they were like, "I don't know what you're doing, but something's that he's doing is working." So I encourage you to look that video up. You can type in Dr. Eric Robbins or Pranic Healing, Master Coe, CBS News, and those little news segments are out there, and they're really inspiring, because if we could have pranic healing in the hospital setting, maybe we could reduce the amount of pain medications that we're giving people, right? Because pain medications cause a lot of other problems. Although if I need it, I will take it, right? If I need to go to the hospital, I will go to the hospital. If I need the morphine or have a surgery, I'm taking it. I'm doing the medical side of things. But maybe we can reduce some of the negative side effects of medications, and some of the negative, side effects of the surgeries or the whatever is being done in hospitals. And maybe we can also, what have we said almost every video so far in this series, is that pranic healing accelerates the body's natural ability to heal. So what if you can reduce the time it takes for somebody to heal after a knee surgery, or like a knee replacement, or a spinal surgery? What if you could reduce the amount of time it takes for you to, or for your client, or for you to heal, right? So Master Ko, my teacher, has a great story about his wife. She had a fall and Master Ko had done pranic healing for her and regularly, and her healing process was so much faster. She was up and walking from a broken hip within, I think, a month or something like that, when it was supposed to be many months before she was even going to be walking. So what if we could just integrate pranic healing into the medical setting, and it's slowly happening, but if it happens on a wider scale, just imagine what could happen. So in pranic healing, and I'll finish with this. I'll finish with two things because I want you to have an experience, not just listen to me talk. In pranic healing, we have a goal. It's a pretty big goal of having one pranic healer in every household or family. Because if you just have, I mean, this isn't going to replace your drug cabinet, but maybe drug cabinet, is that what you call it? Where your medicine cabinet. It's not going to empty your medicine cabinet, but maybe it might reduce the need for some of the medications that a lot of people don't want to take these medications. So what if we could reduce pain without having to take an anti-inflammatory drug? I try. So my first line of defense is always doing pranic healing if I have a headache or anything like that. And then if it doesn't work, I'll usually do the medication. But if you're a client of mine, you will know that I will tell you, take the medication, do what the doctor said, let me do pranic healing too. So that's how I want to end our talk today is, just think about, maybe you're a medical professional. Think about ways that you could see this in the medical industry, in the typical medical industry, and notice if you see maybe pain management, or some family clinics might start to have acupuncturists or pranic healers or massage therapists doing healing in the clinics or in the hospitals, in the healthcare setting. So notice if you see that out there, and then notice how many of these natural healers you see out there when you're just driving through the street, and just count how many you see. They're everywhere. So at one point they will become integrated, and that's one of the reasons why we don't call it holistic medicine, we don't call it alternative medicine anymore, we call it integrative medicine, because the point is to combine it with the Western medical approach. So that's where I want to leave you today, but I also want to show you the technique that we use for energizing. So raise one hand, and you can imagine like a pillar of light coming into your hand, and you can breathe with your belly, right? So you can take deep breaths with your belly. Inhale and hold. Exhale and hold. Imagine that beam of light coming down. Inhale and hold. Exhale and hold. Now gently raise your other hand. Keep your armpits slightly open. Continue to breathe. And imagine energy coming into the receiving hand and now out of the projecting hand. Continue to do your breathing. Inhale and hold. Exhale and hold. Inhale and hold. Exhale and hold. Just keep going. Do you notice a sensation on either of your palms or in your body? Is there something that you notice happening? Continue to do breathing. Some people will say, I'm not going to tell you what to feel, but some people, because there's really no wrong answer, some people will say they feel a tingling sensation. They'll say they feel heat, vibrating. Right? There's a lot of different words for it. And one of the special things about pranic healing is that it gives us a vocabulary for the unseen. It gives us a vocabulary for energy. Because there's not always a vocabulary for it. So try this out. Practice this normally. Right? At a certain point, for me, it starts to feel heavier, like there's a weight on my hands. Right? So this light that we're projecting is the energy of, it's prana or ki. Right? It's the vital energy. And though this series is called The Light Within, did we take the energy from inside of ourselves? No, we didn't. We pulled it in from the environment and then projected the energy. So though pranic healing is a healing energy modality, we are using a different source of energy. We're using the energy or the chi from the environment. We're not using our own energy. So I'll leave you with this. Who does the energy touch first? If I'm working on you, if I'm energizing you, who touches the energy first? Okay. So as a pranic healer, if you do the pranic healing method, you will never be drained of your energy. And you will never have to do extensive chi cultivation exercises to have a lot of energy to give your clients. Right? And I've seen healers that after 2 healings, they're laying down on the couch. They have to go and take a nap because it drains them. Right? But by doing pranic healing, since the energy is flowing through you, you're not using your own energy, your own chi. You get energized first. Anyway, hopefully that was a helpful, thought-provoking insight into pranic healing in the series, The Light Within. And if you have any questions or comments, put them in the comment section or send me a message, and I'm happy to help. And if you have any suggestions for other content that you would like, let me know. Have a wonderful day, wonderful evening, night, whatever time, day, or place you're watching this. Have a great rest of your day. Take care.